Well, it's New Year's Eve, and it's 25 degrees outside here in Lions Head Mall. Right here in the studios, I have Dr. Kevin Planter, who is the hand specialist at Steadman Hawkins. Good morning, Kevin.
Good morning, lady. How are you? Happy New Year.
Happy New Year to you as well. How's everything going?
It's going terrific. We're excited. The snow's falling, and hopefully there'll be some skiers out there today.
Yeah, no kidding. Now, tell us, you're not new to Steadman Hawkins, but you're new in sort of this position that you've taken on. Tell us about how this works.
Right. Last year, I finished the fellowship with Steadman Hawkins, and I had trained earlier with Dr. Strickland in Indiana for hand fellowship training, and now I'm here once every 4 to 5 weeks in the Valley, as well as during the holiday times, to hopefully help out to become full service so that we can do not only the shoulder and knee and the elbows that we've done, as well as all the trauma, but the hand and the wrist.
Now tell us why that's important to specialize in the hand and the wrist. What makes that such a unique part of the body to work with?
As you know, the hand and the wrist we use every day. We grab it for our ski poles, for our turns, and any part of life. And sometimes takes a little more training and things to do to look at the intricate parts. And so we have special instruments to use, and hopefully not allow us to think that even though we don't walk on our hands, that there's definitely some important things that we shouldn't live with, some aches and pains that we wouldn't live with in our knees.
Now, what have you seen the medicine change with regards to hands? How has it progressed from the past to now?
We used to think that it's okay to have some pains in the wrist and the hand, but really now we should really find out what the diagnoses are. And wrist sprain is an old term, and now we know some of the new terms of exactly what seems to be wrong at each bone, ligament, or how we can help people.
You know, a lot of times people mention, you know, anything wrong with their hands, the first thing they say is carpal tunnel, and
right.
But there's actually so many different kinds of things that can go on. Why don't you tell us a little bit about what you see?
Carpal tunnel is very common, but for most of our skiers, we have more problems in the thumb, and we have in the wrist. When pole plant, people have pains. And since we have a lot of athletes in the Valley and our visitors, we get impingement sometimes of some of the extra material that's in the wrist, and we have ways to look inside the wrist to see if there is extra material. The snowboarders take some excellent falls, especially when there's some packed powder, as we've had in the past, and unfortunately break their wrists. And we can use an arthroscope or a little telescope to look in sometimes to see how bad the surfaces are, hopefully clean them up, rid them of their pain, and get them back out there snowboarding.
Now, you actually brought one of these in, because I've heard about these, and the technology behind it to me is just fascinating. This is an arthroscope, right?
It's an arthroscope. It's really not different than your big TV camera. And it has a light source.
This is a television camera.
And this is like a television camera. It's just a mini. And so we can look inside without making an incision so people can recuperate faster. And that's our goal, hopefully, for all areas of the body. This is a light source. This lets us look right there. And the TV camera is right on the back. And it allows us to make a little nick in the skin and then go in, and the patient can be awake, and actually most patients seem to enjoy it. It looks like a little Jacques Cousteau underwater, and you can watch the whole procedure while you're awake with just the arm asleep.
This is so amazing that this whole, you know, contraption is actually a camera and has a light source, like you've said. Now, you use this to help diagnose sometimes. You can also use it to treat? Is
right.
that part of it?
You can put this in one part of the wrist because it is so small, and in the other part of the wrist we put in a little shaver. Some of our patients call a little Pac-Man, and it little chews up some of the material that could be floating around in the wrist, that it may fallen off when someone hit their wrist. And so we can treat, not only be diagnostic, but therapeutic in how we use the arthroscope. Sometimes the patients the next day can take off their dressing and keep it dry and be up on the ski slopes if it's something minimal. There are some people that need actually clean-outs of their wrist and on a yearly basis for other ailing things that have let them get back to their activities quicker. And most of our unfortunate accidents or things that happen can now be treated in a faster fashion.
This is amazing, the way that where technology has gone and what it enables you to do as a doctor and to treat people.
It's made us do a lot of procedures that we normally wouldn't have been able to do, that we did call a wrist sprain and no longer call a wrist sprain, and help us.
Let's go back to what, in terms of the carpal tunnel, that's a repetitive kind of motion that people get. Is the repetitive kind of motions that people have, does that lead to other problems besides carpal tunnel? Is that something they should be aware of in terms of prevention?
Most patients who have carpal tunnel tell you that They have to shake their hands out at night, that their fingers are numb and tingly on their thumb, their index and long finger, and sometimes even when they brush their hair, or driving a car, that they get numbness and tingling to the fingers. Sometimes you don't have to do anything but give a local injection or even just splint it. And you'll find that at night we all sleep, sometimes we curl underneath our pillow with the wrist down, and that can sometimes aggravate that nerve. And so there's some simple things to do, like splinting, and that's simply taking the wrist so at night we can't curl our wrist, and treat carpal tunnel in a simple fashion. For those people that need carpal tunnel that have to be fixed, we can do it with a different device which looks very similar to this arthroscope. It's called an endoscope, and we can put that in as well, once again without making an incision. And so we can do it both with an incision or without an incision, and that's given us a lot of options and lets the patient choose really which intervention they would like.
Yeah, no kidding. Now, if people want to come see you and talk to you, how do they go about finding you?
If they call the Steadman Hawkins Clinic, we'll be more than happy to see anyone at any time for any of their problems. Hopefully they'll be on the slopes instead, but it's 476-1100 at the Steadman Hawkins Clinic, and we're here for all the visitors in the Valley, and hopefully anything that they would have questions of, please feel free to come by.
Now, you wanted to wish Happy New Year to a couple
I do
people.
have to wish Brian and Jamie a happy and a healthy New Year.
You can look right there and talk to them.
And for all of you in the Valley, I hope you have a great evening tonight. And Brian and Jamie, I'll see you in a little while.
All right. Thanks, Kevin, for coming in. We appreciate it. It's
Thanks a lot,
great to
lady.
have you in the Valley. We've been talking with Kevin Plancher here. He's from the Steadman Hawkins Clinic, and he is basically their hand specialist, although he treats everything else. But if you have any questions regarding your hands, any kind of pain, you don't have to live with it. Go see him, and he can take care of you. We'll be back right after this.
Ski equipment has come a long way since Pete Seibert and the 10th Mountain Division pioneered Vail. Cap skis, new profiles and side cuts, composite poles, and comfortable boots. At Banner Sports, we rent only high-performance equipment. Tina Starr's multi-profile skis for excellent maneuverability and aggressive go-anywhere skiing. Solomon's monocoque skis for extraordinary performance. And Lang boots. High technical features combined with comfort and ease. Every performance rental at Banner Sports is complete with complimentary overnight